Hey guys, and welcome to the demo on demand of our MEDITECH integrated eConsent solution with a specific focus on solving the paper challenges around informed consents. All right, first thing I want you to know is that we know MEDITECH. Roughly 65% of our customers are MEDITECH, and we're an official MEDITECH partner, but our relationship goes much deeper than that. We're also part of the new integrated MEDITECH as a service offering. We do joint development with MEDITECH, and get this, MEDITECH is actually a customer of ours. That's right, they actually use our technology at their organization to solve their own paper challenges. Anyways, we've been a technology provider in the healthcare space for around 20 years, and primarily our customers have used our eConsent solutions to solve the paper challenges in the registration area. And naturally, our customers over time have challenged us to further develop our eConsent technology so that it could solve the more advanced paper challenges inherent with clinical consents. And as we've developed our solutions jointly with MEDITECH and MEDITECH customers like you, two things have become very clear to us as we've developed these solutions. Number one, the solution has to integrate inside of MEDITECH as much as possible. And number two, whether we're talking about clinicians or patients, the solution has to be simple, straightforward, and easy to use. So with those two key things in mind, we created a very elegant solution to meet your needs, and it's broken up into three distinct stages that we call shape, sign, and send. And we're going to go through each one of these stages in this demo on demand so that you can see how the comprehensive solution will work in your MEDITECH environment. But look, should you want to jump ahead or go back at any point in time as you go through this demo on demand, we've made that easy for you. We've created breakpoints in the timeline below, so again, you can navigate through this demo on demand as easily as you would like. All right, so with no further ado, let's get into it. The first stage, stage one, it is the shape stage. And guys, this is where the informed consent takes shape and it becomes ready for the patient's e-signature capture. And this stage is really special because it's all about MEDITECH integration with the intention of making the lives of your clinicians as easy as possible. So when I talk about MEDITECH integration here, I'm talking about two specific types of integration. One of them is workflow or action-based integration, and the second one is actual MEDITECH user interface integration. And first, let's cover how we can leverage an upstream MEDITECH event to automatically initiate the informed consent process. So when a clinician places an order inside of MEDITECH, let's say for an appendectomy, we'll use that information to automatically create the electronic informed consent for that patient. And at that same time, we want to solve the problem that we often see clinicians dealing with, which is handwriting procedure content onto the forms. And we do that by merging comprehensive procedure-specific content, such as evidence-based risks, directly onto the informed consent. And by the way, look, I know what you're thinking, and the answer is yes. Should your clinicians want to alter that information, edit that information due to whatever circumstances, they certainly can. Now let's cover MEDITECH user interface integration, which is massively important because the last thing we want to do is to ask your users to leave their MEDITECH experience to deal with some random third-party application. And we get it, guys. It's all about making lives easier and more streamlined for your clinicians because we want them to stay in their MEDITECH experience. We want the interface to be so streamlined that they actually never know they're dealing with a third-party application. They just think they're dealing with MEDITECH the entire time. That's our goal with that user interface integration. So let me show you what that actually looks like. Okay guys, so we're really excited about this. Here is the MEDITECH Expanse user interface, and we're inside of a patient record. All right, so if we're ready to launch our application, we're able to do that by this little button down here that says Passport Form Launch. So I can click on that, and upon doing so, it will then bring up our solution within the Expanse UI. So let me show you what you're looking at here. On the left-hand side of the screen, this is where we have any forms that are currently awaiting or are staged for the patient. And in this case, you can see we've got an informed consent. Now, the reason we have an informed consent is because an order has been placed for this appendectomy procedure. So our system used that information to automatically initiate the informed consent and bring all of the information for the appendectomy procedure onto that form. However, if I needed any additional forms at this point in time, I can very easily go over to the right-hand side of the screen. So we're able to put different forms into different form groups. And as you click on those groups, you're able to see the different forms associated with that group. So I could simply select any additional forms. They would then go over to the left-hand side of the screen. Now, one important thing of note here is that we want to ensure that we are presenting the appropriate forms and form groups to the appropriate users. So we're able to use information on your users to restrict the forms and the form groups, again, because we just want to make sure that the right people are seeing and have access to the appropriate forms. All right, now I'm ready to present the form to the patient for e-signature capture, which ties a bow on to stage 1, and now we're ready to get into stage 2. All right, guys, so let's get into stage 2, the sign stage. All right, now in the sign stage, obviously, this is where we are going to be putting the electronic consent form on a tablet and presenting that to the patient for their signature. And look, the name of the game in this stage is actually mobility, because the patient could be anywhere. They could be in the inpatient setting, in the perioperative space, labor and delivery, cardiac cath lab, radiology. Look, I mean, you get it, right? The patient could be anywhere, and consents are signed anywhere throughout your organization. So using tablets, bringing the form to the patient wherever they are, massively important. Now the question is, how are we able to get the forms onto these tablets? We do something that's called handoff. It's a really simple, elegant solution to transferring forms to these tablets. And this handoff can occur at one of two locations. It can occur at the workstation level or at the patient's bedside. So let's talk about the workstation level. So I'm in the workstation, I'm inside of my EHR, I've chosen the appropriate forms, now I'm ready to hand them off to the tablet. I would just simply press the handoff button inside of our user interface. It brings up a barcode on the screen. I take my tablet, I scan that barcode on the screen, and it transfers those eConsents to my tablet, okay? Now, alternatively, like I said, we can do this at the bedside. So I could be at my workstation, I can queue up all of my forms, but rather than bringing up a barcode at the workstation level, I grab my tablet, go to the patient's bedside, I scan their barcoded wristband, and voila, same effect, all right? The forms are transferred to the tablet. Now, I can present this to the patient for the e-signature capture. So here you can see on this tablet, I've got the informed consent for the appendectomy procedure. So I can read the form, I can look at the name of the procedure, the risks, all of that. I can interact with the form. For example, in the middle, there is a section about do I want blood products, yes or no? And let's say that I choose yes, I do want that. Now, that can be a required field, so that you can't complete this form without filling out that section, and one of the things we want to do, of course, is make the form electronic, but we also want to human-proof the form as much as possible and reduce those opportunities for error. Anyways, now I'm ready to sign off on the form. I bring up the signature capture field, I'll use my finger, and I'll just sign my name. So there's my signature. I'll touch OK. My signature is applied to the document. It's time and date stamped. It's all good to go. Now, if the surgeon's right here, which oftentimes they are, I can hand this over to the surgeon and they can sign off on it either using their finger or PIN code, username, password, something like that. But in many cases, though, the surgeon or the clinician is not present, and so this needs to be routed to them. So we can electronically route this form to that clinician, ensuring that it doesn't get lost, which of course is a big deal, and that's a really nice segue as we get into stage 3. All right, guys, so here we are in the final stage, which we call the send stage. And it's really simple what we're doing here, but it solves one of the biggest problems with paper-based informed consents, which is that these little boogers can get lost getting from one point to another, which of course can mean all kinds of problems and delays on the day of surgery. So once we've captured all the signatures, we're simply going to submit the document instantly to your enterprise content management system. No paper, no sticky labels, no scanning by the HIM staff, and arguably it's one of the most important things here that we are eliminating lost forms. So there you have it, guys. There's our integrated and tablet-enabled eConsent solution. We're all about combining thoughtfully designed technology and breathtakingly good customer service so that we can solve the array of paper challenges facing your hospital across the entire enterprise. And yes, we want to solve your business challenges with paper, but we also focus heavily on making the lives of your clinicians just that much easier. And I'm sure you'll all agree that happier clinicians does have an effect on the patient experience. So thanks, guys, for taking the time to walk through this demo. And if you'd like to learn more, just fill out one of the forms on this page and we'll get with you straight away. We are Access eForms, and we believe that you deserve better than paper. Thank you.